America is a unique and great place to live. We have one of the best economies on earth and are the richest country in the world. We have a political system with the right to vote for what we like and don't like. But we do have our faults. Take, for instance, our healthcare system. It is operated with making lots of money in mind and no thought as to who can actually afford it. So who deserves quality healthcare? Healthcare should be available to all. Given the United States' wealth, Americans should be healthier and live longer than what we currently do. We should all be treated equally and receive comparable health care, which is why universal health care should be adopted in the United States as it is in most other countries with great success. The cost of health care has been growing in leaps and bounds. Since 2000, health care insurance plan prices have increased by 73%. In 2005, the cost rose 9.2% alone. Inflation at the time was a little over 6%. Figures like that can be daunting to the average American trying to support a family and attempting to stay healthy. Imagine if you were the person who made below the national average. How would you survive and make the tough decisions required to survive? I, along with many other Americans, have had to make these choices. I am not lazy, nor do I expect a handout from the government. I work hard for my money and I pay my taxes. A study by the Kramer Institute talks about the effects of high costs of health insurance. In 2001, 1.4 million American families filed for bankruptcy. To investigate medical contributors to bankruptcies, they surveyed 1,771 personal bankruptcy filers in 5 federal courts and subsequently completed in-depth interviews with 931 of them. About half of those declaring bankruptcy cited medical causes. Among those whose illnesses led to bankruptcy, out-of-pocket costs averaged about $12,000 since the start of the illness. 75.7% had insurance at the onset of illness. Medical debtors were 42% more likely than other debtors to experience lapses in coverage. How would universal health care decrease these numbers? There is the Kennedy-Dingle plan that would be paid for by increasing taxes. Dr. Tim Johnson, in an interview with ABC, stated that, for example, most companies spend 13% of all their payroll costs buying their employees' health insurance. Under this system, the companies would pay a new 7% payroll tax. Healthcare costs for employers would be cut nearly in half, and the government would still have enough money to finance the new plan because of efficiencies and savings. With public and private options, people would have the freedom to choose a plan that best suits them and their family's needs. And since we, the employees, shoulder most of the financial cost of having insurance through steadily high climbing deductibles, the employers would save money through this plan and may even gain more respect from their employees. Under the bill, Medicaid would continue to provide services to persons with very low incomes and disabilities. So as the plan describes, anybody with a job would have insurance and a choice of what kind of coverage they would like. Employees would no longer have to make a decision between paying bills or having health care, but could afford both. Of course, with anything, there's always two sides of the coin. This is no different with health care. One of the more popular arguments you will hear against universal health care is that the government can't run its current programs. They like to look at Social Security and education, which are both governmentally run, as an example. We should have seen the Social Security system headed down the hill a long time ago. The program was created in a time when people didn't really live that long, as they do today. And education, it would be better if we went ahead and actually spent our tax money on education. The healthcare system is big in the United States. It would be best to go ahead and let individual states get the process moving forward towards an overall universal plan. This would give the federal government enough time to get things straightened out. It would also give us time to discuss and implement guidelines, rules, and regulations. Another argument against universal health care is if it were to be implemented, it would be too complicated and too time-consuming to actually have it be useful to anyone. Anything new takes time to set up. I don't think the school system was created in a day, nor was the American highway and road systems. It all takes time, planning and more planning to get it to where we are today. With careful management, dedicated planning, and careful transitioning the planned stages at a time, we could see a very successful healthcare system. The most important part of this speech is that we all have a voice to change the current system. We all have the opportunity to be heard through a vote. This voting process happens on all levels of government. The people will ultimately choose who is in control of our tax money and what programs are actually being brought up. Healthcare is something that every American should have. At the very least, it should be made affordable for everyone. We are the wealthiest country in the world, but our rankings in healthcare and death rates say that our current healthcare situation is entirely out of control. Even though there is a lot of legislation out there for universal healthcare, there is also a lot of big money corporations out there that don't want to see their huge profits cut. According to the International Tax Review, we pay around 35% of our earned money towards taxes. Not bad if you compare it to other countries around the world. So why not use our taxes that go towards helping others, or go towards helping better our nation and its survival and the world? But we'd rather go into other countries and send them money to help better their way of life while letting down our own veterans, elders, and poor suffer. We give our government the okay to control our schools and transportation, but opponents of the universal health care think the government will do us wrong in health care. And when given the chance to fix these things by spending money, we complain about it, vote no, and wonder why we still have the problems. Hopefully this speech will persuade you enough to check out the facts for yourself. There are a lot of resources available and a lot of highly opinionated people behind them sources. We all know someone or have heard a story of someone who has been hurt by the current health system. It is time we open our eyes and stop acting like sheep and start figuring out the facts for ourselves, instead of believing everything we see on television and what we read. It is time we stop thinking that health is only optional. It should be a right. Let us stop thinking about ourselves and let us expand our hearts to those around us also. And let us remember that it is up to us to use our power to vote to have responsible people represent us.